Aloha, welcome every morning. Good morning. Happy Saturday. Welcome to the COVID Care Conversation. It's a forum for us to talk about the latest news about the coronavirus pandemic around the world, but specifically here in the islands. This discussion is brought to you by the Hawaii Executive Collaborative. That is a consortium of Hawaii civic and business leaders that have come together to make Hawaii a better place. Good morning to Antonio and to Dini. I'm Yanji Denise.
And I'm Ryan Kalei Suji. This is sort of our way to kind of connect with all of you who are watching here on the platform of the Honolulu Star Advertiser Facebook page. Right off the bat, we want to thank you for tuning in. We are here every day. We're going to be here for the span of 2 weeks. We started on Wednesday. And really, we want your help in getting this show out there so that we can reach as much people as we can to provide up-to-date information, as well as hear from you, some of the viewers and some of the people tuning in. We have a lot of you who are tuning in this morning. We want to say thank you. Another thing we want to encourage you to do is please share this video on your platform so that we can reach your networks as well. We want to hear from all of you about what you're experiencing, where you're watching from, as well as our friends that may be watching beyond the waters of Hawaii. We really want to be able to use this as an opportunity to engage with all of you out there.
Yeah, and we've been reading a lot of your comments from the days before, and a lot of you have been asking about our homeless population and how we flatten the curve in that particular group, more than 7,000 homeless across the island. So we have a special guest coming up. The IHS Executive Director Connie Mitchell is joining us to talk about the efforts there and also about how you can help. So get your questions ready for her. What do you want to know about what IHS and the state and the city is doing when it comes to flattening the curve among the homeless? Type your questions. She's going to be joining us in just a few minutes. But first, of course, we want to start with the latest headlines. And Ryan, we have a new count.
That's right. The count continues to go up, as we know that, and we heard from officials that it will. 120 positive cases have been reported as of yesterday. Again, a new update is expected sometime around noon today. There was a total of 14 new cases that were added yesterday. Again, Oahu continues to lead the count. There were a few more also added to the island of Maui. Also important to note that some of those numbers also include non-residents of Hawaii. So there are visitors here that are also going in for these testing stations that are here that have tested positive as well. And again, the state entering day number 2 of this 14-day quarantine, where those arriving to the state will be required to shelter in place and stay in for the next 14 days. So again, those numbers continuing to rise.
We know a lot of you have questions about testing. This weekend, just like last weekend, there will be drive-through testing. They're going to be offered in 2 sites. The paper has a good write-through of that, but just briefly, Kaka'ako Waterfront Park, that's on Sunday. Today is Waipio Peninsula Soccer Complex. That's from 8 a.m. to 2 p.m. Now, before you get in your car and drive down there, these are some numbers you can call that we put on your screen. If you are interested in getting tested before you drive out there, waste the gas and sit in line, call one of those numbers. Make sure that this is something that you should actually be doing. Kaka'ako Waterfront Park last weekend, they had huge lines, but only about 40% of the people actually got tested. That's because you do have to go through a verbal screening where they will ask you about symptoms. And if you don't meet those requirements, the criteria rather, they don't want to waste a test because the tests are limited. They want to do as much testing as possible, but they can't unfortunately test everybody. So they want to make sure that you have actual symptom criteria. So check the article today lists exactly what that criteria is, and you can call the number right there on your screen.
Yeah, and of course, this is a great resource for all of you watching who may be thinking that you want to go and get tested. Again, we don't want people waiting and stalling in their car during this time when really they're not meeting the criteria. So call that number again. Eligible for testing, it includes symptoms such as the fever, cough, shortness of breath. They're going to ask you about your travel history. But also just, I think that is a great resource, that phone number there that they've actually set up to help limit the amount of people that are just going down there to hopefully get tested and only to be turned away because they don't meet the criteria. So great resource for that.
And we're seeing some questions come in about the homeless. Please add more questions as you go along. We want to introduce now Connie Mitchell, the Executive Director of the Institute for Human Services here on Oahu, or there on Oahu, I should say. I'm on Hawaii Island right now. Connie's joining us from her office and has some very exciting news when we're talking about how to flatten the curve among the homeless. So good morning, Connie.
Good morning, Angie and Ryan.
So tell us about the new efforts, the Ka'amahu building, and what's being done there in terms of actual quarantine, and also about the H4 testing, if you would.
So a couple of weeks ago, we were really thinking that we needed to have some place where people could go who were starting to exhibit symptoms and maybe were awaiting test results or had tested positive already. Unfortunately, we haven't had much testing among the homeless community, so that's why we haven't seen that many positives, or I don't know of any that really are positive so far. But I think as we begin to test, it's going to go up, and we really want to identify the people who are most vulnerable. So the building is actually right next door to us, across the street from our Ka'ahi Women's Shelter in the Iwile area. And it is a building that, we, along with Local 5 and H4, which provides urgent care to homeless people, we're going to be getting that up and running within about 8 days from the time they told us that we might want to do that. But that would give us a place to actually have people stay away from others who have tested positive, and then also those who are waiting the test results. So we're really excited about that because we really want to separate those people that really could infect others.
I know that when testing does ramp up, they're talking about being able, H4 is being able to test and H4, for those of you who don't know, is the Hawaii Homeless Healthcare Hui. They want to start testing coronavirus in some of the larger homeless encampments. Can you tell us about how that's actually going to work and how many people you're expecting to be able to test?
So again, as they did with that large testing, not everybody is going to be tested. There will be screening to determine whether they should be tested or not. So our outreach team is planning to go out with H4 medical personnel who will do the testing. So we'll be screening, and we already have done some surveillance of the folks that we believe are more vulnerable, that we really want to make sure that they don't end up getting the coronavirus. And just to let people know why it's so important, among the homeless community, people are generally more mobile. They're always moving. They're really going from place to place. And we've been told shelter in place, but they can't stay in one place. They're looking for the basics like water and toilets. And so if they can stay put, we really can have a better chance of helping them to shelter in place and get the supplies that they need out to them. So they're mobile. And many people who are chronically homeless also have a lot of what we call comorbid conditions, or like a lot of different medical conditions. They might have diabetes, they might have heart disease or renal disease. And it makes them much more vulnerable. If they were to get the COVID-19 infection, they are likely to end up in the hospital. So that would mean that they're going to end up taking up more room in the hospital also, just like anybody else, because, hospitalization is equal opportunity. So we really want to flatten the curve by helping these folks who are very vulnerable not end up getting sick. So I think those two things, being mobile and vulnerable, and a lot of times congregating, they usually cluster, and they're in our shelters, and we've had to look at ways to just kind of make more space for people so that they aren't as likely to pass it on to someone if they did get infected. So that's the way to flatten the curve.
Connie, what about the overall just the access to information? How are these those on the street and homeless? Do they know about just how severe this disease is and this pandemic? What are sort of the education efforts just to kind of keep them aware? Of course, we have access to internet and information, but how are they getting that information?
So our outreach teams are going out and letting people know about, we're passing out flyers to let people know about the basic ways that they can keep themselves safe, but also to learn more about the coronavirus. And so we really try to do health education as well as, giving instructions and then some supplies that might be helpful for them. But it's ranging from what's going on, they don't know anything about it, to them really knowing a lot about it, because many of them have smartphones and they are able to access the information on the internet. And then there's the coconut wireless, and people do pass on the information, thankfully. So I think there's a range.
We want to bring in some of the viewer questions. So Brandon Sugiara says that he wants to know, can people still make donations to the shelter? What is the procedure for that? And are volunteers allowed to make meals for the homeless, as folks are also encouraged to stay home? So can you tell us about how the public can get involved with this effort? Because it is going to take quite a few people.
So to answer Brandon's question, yes, we really do welcome donations of meals still. Some people might be willing to come in and actually help make sandwiches or to cook a meal. You just have to get in touch with our meal program manager, Anna, and you can do that through our website. So please go on there and look at ways you can volunteer. We also need people to help us screen, because we've been screening in the shelter every day, for about a week or so now. And it really is to make sure that the people that we are sheltering right now are not ill, and that we get the first sign of illness, a fever, or just some symptoms. We just want to catch it really early so that they get the health care that they need. We also could take a lot of different kinds of donations, not just monetary, but we need thermometers, believe it or not, because our thermometers are we're burning through them, real quick, because, we don't have the medical, grade thermometers, but we are trying to get some, and the sleeves that go with them. We also need, I wanted to show people have been making masks for us. These are really beautiful. And we need other regular surgical masks as well as the N95s. Because we're not considered a healthcare organization, for the past couple of weeks, we didn't get access to a lot of those, what they call PPE, or personal protective equipment. But then people, are donating some that maybe they had left over. And we really appreciate anything that people can give, including hand sanitizer. Hand sanitizers, and also, in terms of the efforts that we're going to make to help the unsheltered people, we need basics like and paper towels, but we want to make kits for people so that they can shelter in place. There's really so much more threat when people are just moving around and not, knowing who they're, really contacting. We really want to know where they are so that we can go back to them, provide the food and the basics that they need. So many ways that people can help. I want to share one more thing that somebody donated to us just this week. South Seas Canvas, kind of decided that they would make these face shields for us. So these kind of protect us and help us when we're screening and we're out there in the community when we really don't know what we're dealing with. So it's been very, very appreciated. So there's all different kinds of ways that people could help us still, and we really want to interface with you to be able to talk about that.
So we've actually put a link, or I know that your team there has provided a link of the items that you folks need. It's in the comment section here that we've popped up. But we'll also be posting this in our show notes. And you'd also mentioned, aside from those listed items, there's also ways that people can volunteer to get involved. You said you need help with screening. We also want to remind people that you can head over actually to coronavirushawaii.com, click on the How I Can Help, and you can fill out your information. That includes just your name and your contact information. If you would like to volunteer for IHS and be a part of that, please fill your information there, and we can get that over to those at IHS.
I know some folks are also watching from the neighbor islands, and there was a question that came in a little while ago. I'm trying to find it now, asking about what about the neighbor islands? Can you tell us a little bit about what's being done to flatten the curve among the neighbor island homeless populations?
I think the neighbor islands have more of a rural population. So I think they're doing a lot of the same things that I mentioned also. They're going out doing outreach, to a lot of people. And, I want to also say that we haven't stopped trying to house people. That is the best way, as far as I'm concerned, to really help our homeless community. So we really are looking for more units, of people who are willing to rent out, to the people who are experiencing homeless right now. We're also anticipating that there are a lot of people who have lost their jobs who will end up teetering on homelessness, possibly if they rent and they're just, going paycheck to paycheck. It's going to be tough. And so we really want to ramp up our ability to really help those folks as well. But I think the neighbor islands also have homeless service providers that are doing very similar things, as the U.S. Interagency Council on Homelessness has put out guidance, on what we can do. If there are encampments, there are definitely some recommendations that we're trying to follow. And, we're definitely trying to also reach out, to other people who may want to volunteer to help with those encampments. For instance, when the public bathrooms opened up this week, we need people to even help, with folks who need, like I mentioned before, the toilet paper and other, cleaning supplies, because they didn't want to open up the bathrooms because people were stealing toilet paper. And so if we can just make sure that people have what they need, we can all be a real healthy community together. And so I'm really excited about the opportunities that we have to organize that way and really make our community feel like we're all in this together.
I know that you said that with the Hawaii Homeless Healthcare, Hawaii H4, which is a public-private partnership, the McNaughton Group Foundation, Hawaii Community Foundation, and others coming together to contribute almost $500,000 to get that testing and services off the ground. The goal is 200 a day. How long do you think it'll take to get there to the testing?
I think, I don't know that we'll be able to do 200 a day, because if you take the percentage of the people that, actually got tested when there was the large group of people that tested, that would mean that we would end up, probably screening about maybe 500 people a day. And I don't think that we'll be able to do that because we have to get out to different places. So we will be able to at least have a plan to really do it for all the larger encampments and the folks that we're normally serving already. So I think the partnership between H4 and the outreach teams are gearing up, and we're ready at IHS to go next week already. So we're going to start there.
Okay.
I want to ask you, this is obviously not something that is confined to Hawaii. There's a lot of other communities that are dealing with how do we help the homeless in this crisis. Have you guys been in contact, or have you noticed or taken note of what other cities may be doing, or trying to find best practices, I guess, in this situation?
Absolutely. And I think everybody needs to know that our state and our county governments are really consulting with other cities that have actually been ahead of us, right? They've experienced a surge already, maybe. And so we're really trying to learn from others and really do the things that really can help us. So as I mentioned before, besides the United States Interagency Council on Homelessness, we're also looking at what Seattle has done, because they had that, huge outbreak. And so they have a lot of larger encampments as well. So a lot of the recommendations are being considered. We also participate in some webinars, with some of the folks that have been helping in those areas. So whether they're in the actual homeless services arena, doing direct services, or in the medical area doing infectious disease, everybody's coming together to really lend their expertise to really do the things that will be most effective.
Okay. Well, thank you so much, Connie Mitchell from IHS. Again, there is a call out for volunteers, for supplies, for whatever you can do. We're going to put that link again in the show notes, and you can please share this video with others, get the word out. If you're at home and you feel like you want to do something, there are definitely ways to help. They don't necessarily even require cash. There's a variety of ways. And Connie, we really mahalo you for being on with us today.
Mahalo, Yinchi. Ryan.
Take care. Aloha.
Wow. Okay. Well, wonderful to hear from her, and wonderful to hear that that center on Ka'amahu will be up and running by Wednesday. They're going to get the testing started. Again, we talked about at the top of this broadcast the weekend testing here. So remember that if you want to get tested, today is drive-through testing in Kaka'ako Waterfront Park, today is testing at Waipio Peninsula Soccer Complex, Kaka'ako Waterfront Park. On Sunday, the hours are 8 to 2. You can see that was last weekend. That's sort of what the procedure looks like. But don't get stuck in that line unless you actually need a test. The number there on your screen will let you know if you qualify.
That's right. And again, we want to thank Connie and all of you for typing in those questions and sending in your questions. I think it's important to note, going back to that, if we can just for a second, that the health of this community, a lot of it will depend on everybody and everyone's involvement. And we've been hearing how officials are saying it's important to stay in, how we all have to do our part. And so the homeless population is a part of this community, and their health and their well-being will impact all of us. So if there is a way where we as a community can help them in this time, to make extra efforts to get involved with IHS to help them reach these people, the better off that we all are as a community, the healthier we'll be, we'll be able to keep those numbers down. Again, there's a list. We'll have the listing of all the items that she needs. But again, if you are interested in potentially helping in this cause to volunteer, she said that we're going to need help with all of the influx of people that are coming in and screening, as well as just taking care. We want to encourage you to go over to coronavirushawaii.com. You can fill out the volunteer section page. We have a sheet there again where you can type in your information. We will send that over to IHS, and they will contact you directly about volunteer opportunities and times where you can come in, because they're going to need all the help they can get. They need it regularly now more than ever.
Yeah, absolutely. And she's right. We're only as strong as our weakest link, as they say. And her point really about how transient this community is really important. So we want to do our best to flatten the curve there. We also want to talk about a few other things that are in the news today. The Star Advertiser has an interesting piece about authorities pushing to restrict neighbor island air travel, taking temperatures. Right now, flight crews are the only ones who are getting their temperatures taken at the airport. The quarantine is in place for people arriving to the islands. That includes visitors and residents, but that's not the case for inter-island travel. Do you think that that is something that should happen? If you come from a neighbor island, should you be forced to self-quarantine no matter which island you're going to for 14 days? It looks like that is a real possibility. General Hara points to Taiwan, that says that in Taiwan, similar measures there resulted in a 40% success rate in identifying travelers who had COVID-19. That's an amazing success rate. So hard to argue with those numbers. It would obviously put more restrictions on people, but we want to get this thing under control as fast as possible. So it might be some necessary pain.
Yeah, so especially for those of you who maybe commute, we know that while we are sort of in this position of being in a shutdown, there are people who still need to travel back and forth for work. Again, the question becomes about what about the flight attendants who are flying back and forth between these islands? So there's a lot of questions, and the things, I think the dynamics of the way in which just Hawaii is geographically situated as a state. We just can't drive from one to the other. Air transportation is a huge part of it. So I know state officials are trying to look at all of those different nuances to try to find a way in which we can provide a way in which we are able to continue to live as normal of a life as possible while also respecting the orders that are coming down. Again, we want to thank everybody for continuing to send in your comments. If you have any other comments, we want to encourage you to keep those coming in and keep sharing this. The other thing that we also want to talk about is just some information that was handed out. The HPD actually released a statement yesterday saying that they are not planning to set up any roadblocks. We know that there are some people out there who are saying that HPD is going to be doing that. They actually issued a statement yesterday saying that is not in the plans, that while they want to continue to ask people to be responsible during this time, they're not necessarily setting up any COVID-19 roadblocks like we're seeing in those mandatory checkpoints on the island of Kauai.
That's right. And the big question in the Star Advertiser today is, do you agree with police cracking down at the stay-at-home violators? Definitely it's okay, or no, it's too much. Right now, definitely is in the lead. I think a lot of people feeling that if they are restricted, everyone should be restricted. But we'd love for you to go online after this to the Star Advertiser's homepage and answer their big question of the day. Vote in that poll. We also want to talk about, very quickly, we have an update from Hawaiian Electric yesterday. We had told you about some of the scammers that are out there. We want to, again, remind you to be careful of the scammers, and also let you know that they have suspended disconnections until May 17th. So you do have a little more time if you are in a situation where you maybe have lost some work and you can't pay your bill right now. You still are required to pay your bill, but you can work it out with them. So head to hawaiianelectric.com to find out what phone number to call or how to get in touch with them. You do have until May 17th for financial hardship claims.
And that was one of the things that was a part of the scam, was people were getting called saying their power was going to be turned off and they were going to be cut off from access. So we hear now officially that it is not. So if you get those calls, make sure you red flag that. Try to get as much information as you can, maybe from them, so that you can report to the authorities who is in charge of this. Beyond of just providing you information, we also want to provide you inspiration and hope of some of the good things that are happening. And one neat thing actually started just yesterday. We saw a lot of people encouraged to eat out thanks to the efforts being made by a local bank, Central Pacific Bank.
Yeah, this is awesome. The idea is that if you go out and you order from one of the restaurants that is choosing to participate, you can get Central Pacific Bank to pay for half of your meal, and you don't even need to be a bank customer. This is their effort to give back, to try to keep our local restaurants going. So you see us. There you go. That's how you participate. You can also go to their website or their Instagram, but just really briefly, you check out a full list of the restaurant, you choose the one, order your meal, take a photo of your meal and your receipt, post that photo and tag the @Keep Hawaii Cooking and hashtag Keep Hawaii Cooking, and also hashtag the restaurant. Then you direct message a photo of the receipt, and then bank will send you a message back on how to get reimbursed. This is all on their Instagram, but this is a wonderful way to support local restaurants. And if you're tired of cooking at home and you could use a little taste of, something familiar that you used to enjoy when you did go out to restaurants, this is your chance to do it.
Yeah, and it's really simple. I mean, it is really just a matter of taking a photo and sending your receipt via direct message to that account, and they actually will pay you back through PayPal. So it's an easy way to do that, and more and more restaurants are jumping on board with this. Again, this is for till they reach $100,000. You have a limit of $100 of the meal itself. So head on over there. They actually have a great website, and so thank you to. It's pretty cool to see how these businesses are getting creative in ways to give back. I thought it was a really cool concept, especially with everyone being on their phone now on social media. Because we're locked up, it's a great way to kind of engage people on that social media market aspect.
I know, and I've been seeing a lot of those hashtags already that keep Hawaii cooking, and seeing all these wonderful places, these restaurants that look so delicious. I'm here on the Big Island and thinking, oh, I really wish that I could participate too. So take advantage of that. Go get a meal, support your local restaurants, and up to $100, that means you get $50 off. That's an amazing deal, and you really don't have to do much for that. Of course, we want to provide you resources. So the city has a hotline for any questions about the stay-at-home order. If there's any confusion as to where you can walk and where you can't and where you can visit, oneoahu.org or 768-CITY. Again, we're going to put all of these in the show notes at the top when the show's over. So we link to all of that. Queens has their call center where you can call and talk about symptoms. We'll put a number for that there. And the easiest way, Aloha United Way, 211. They've got staff there from 7 in the morning till 10 at night. And of course, coronavirushawaii.com.
That's right. And again, we'll have all of that information on that site, as well as in the show notes, as well as like she said, coronavirus.com. We actually want to encourage you pitching for tomorrow's show and getting ready for that. We're actually going to be speaking to Dr. Rupi. We're going to actually have a doctor here that will be joining us. She can actually answer your questions. So if you have specific questions, medical questions about the virus, about symptoms, whatever you may have, please tune in tomorrow. You can also go over to coronavirushawaii.com and click on the Ask the Doctor section, submit your question there, and we can ask it live. Or you can tune in tomorrow, type it in the comment section, and we'll be sure to get those comments to the doctor as soon as quickly as we can. We expect there's going to be a lot of questions out there from people, so we're going to try to get through as many questions as we possibly can. But again, tomorrow we'll be speaking to Dr. Rupi. Head over to coronavirushawaii.com, type in your question or type it in here. And again, this is a great resource for you who may have a few questions specifically for these medical conditions.
Yeah, and Brandon has a quick question. Can I get the link? Well, Linnell provided it right there. KeepHawaiiCooking.com. That's where you go to find out all the details about that Central Pacific Bank initiative, and up to $100,000. That's amazing. Dr. Rupi's going to be fantastic. You guys are going to love her, and it'll be a great way for you to just interact with a doctor without having to, call your medical provider, and just for us to talk about. There's so many myths out there about what the symptoms are, what's effective, what's not. So we can't wait to have her on. And we always like to end with a call to action. The biggest call to action is for you to stay home. Let's all help each other by staying home and sheltering in place as much as we can right now. And we're going to put a link for IHS, and I know that they responded in the comments as well, for all of the things that they need, because we really need to help our homeless population through this difficult time.
That's right. So again, all those information there. We want to thank you for tuning in. Again, continue to spread the word. Let people know that we're going to be on again tomorrow at 10. We're not taking a day off here. We're going straight through this. We're here with you folks. So please use us as a resource. If you have any questions, feel free to type it into the comments. And we look forward to seeing you all here tomorrow morning again at 10 a.m. here on the Star Advertiser Facebook page. Aloha.
Aloha.